Apraxia is a motor disorder caused by brain damage. This brain damage causes nervous system malfunction, such that there is a resulting lack of intended movement and excess involuntary movement. Effects can range from mild to severe. In the milder cases, the disorder is often called dyspraxia. Let's now go through different types of apraxia. Keep in mind that a person may have one or more apraxias, depending on which part of their brain is affected.
Limb kinetic apraxia. This is the inability to make precise movements with a finger, an arm, or a leg. An example would be when a patient is unable to use a screwdriver, notwithstanding that they understand its use, and how they have used it in the past.
Ideomotor apraxia is the inability to carry out a command from the brain to mimic limb or head movements performed or suggested by others. This is due to difficulty selecting, sequencing and using objects. Ideomotor apraxia can be masked by hemiplegia, meaning where a patient has a one-sided weakness or loss of movement function.
Conceptual apraxia. This is similar to ideomotor apraxia, but a more profound malfunctioning, where the function of tools is no longer understood.
Ideational apraxia is the inability to create a plan for a specific movement related to an object. The patient is unable to make the plan because they have lost the concept of what the object is actually used for.
Buccofacial or orofacial apraxia refers to the inability to coordinate and carry out facial and lip movements such as whistling, winking, coughing, etc., on command.
Constructional apraxia occurs when patients display problems drawing or copying simple diagrams, or constructing simple figures. A patient may be aware, for example, they did not draw a house as requested, but unable to correct the drawing.
Oculomotor apraxia relates to difficulty with eye movements.
Dressing apraxia occurs when there is an inability to dress properly, despite the patient having adequate power and sensation.
Gait apraxia ranges from severe, where a patient may act as if their feet are glued to the ground, to milder cases, where hesitant shuffling steps are observed, and where the patient is unable to step over an obstacle.
Finally, apraxia of speech relates to difficulty planning and coordinating the movements necessary for speech, such that perhaps potato is pronounced as totapo or tapato.
So, what causes apraxia? A genetic cause is possible, especially in the case of oculomotor apraxia. However, acquired brain damage such as in stroke, trauma, tumors, and dementia are most common causes. The damage produces a deficit in the brain pathways containing the memory of learned patterns of movement. This makes retrieval of these memories difficult or impossible. The damage is almost always in the dominant hemisphere of the brain.
Can apraxia be treated? The good news is that it may not need to be treated. For example, if it is due to a stroke, it may actually subside within a few weeks. Clearly, if not, treatment of the underlying neurological issue is most likely to improve the condition. Where this is not possible, various therapies may assist, and these include physical, occupational, and/or speech therapy depending on the type of apraxia to be treated. In more progressive or non-treatable cases, compensatory strategies can be taught to the patient and their families or caregivers. These include singing or using facial gestures for speech apraxia, or learning new ways of performing daily tasks, for example in limb kinetic apraxia.